If someone presents with a complaint of a headache, the first thing you need to ask, are there any red flags? Such as fever, focal neurological deficits, age more than 50 years, progressive nausea and vomiting, thunderclap, headache. SNOOP is the easy way to identify red flags. S stands for systemic sign or symptoms and secondary risk factors, such as fever, weight loss, malignancy, meningism. N is for neurological sign or symptoms, such as change in strength, speech, and vision. O is for onset. O also stands for old age, more than 50 years of age. P is for progression of existing headache or pattern change. If there are red flags, then it is a secondary headache. The causes of secondary headache are broadly divided into vascular, tumor, trauma, infection, benign intracranial hypertension, ophthalmological problems, toxins, metabolic causes, sinusitis, dental problems. Secondary headache require intense investigations such as lumbar puncture, biopsy, MRI. No neuroimaging for stable headaches like migraine. No CT scan when MRI is available except in emergencies. In absence of red flags, there is a need to take history and do physical examination for primary headache. Primary headaches are tension headache, migraine, and cluster headache. How to approach history? History should start with open-ended questions, then close-ended questions such as, could you describe the typical headache for me? How does it start? How long does it last if you do not take medications to stop it? How many days per month do you have headaches? How many headache-free days do you have in a month? When was the first time you had a headache in your life? Do you ever have a warning that headaches are going to happen? If you want to show sympathy, you can say, I am sorry to hear that these headaches are so disabling. Let's talk through some cases. 26 years old woman with unremarkable past medical history presents with the chief complaint of one-sided headache. Migraine headache is unilateral or bilateral frontotemporal headache. It is moderate to severe in intensity. Onset is gradual, worsening in the PM. Duration is from 4 hours to 72 hours. It is throbbing in nature. It can be treated with NSAIDs, triptans, valproate. Prophylaxis is tricyclic antidepressants, anticonvulsants, propranolol. Let's talk about the phases of migraine. There are 4 phases. It's not necessary that all phases are there, but if they are present, prodrome is a phase when there is a feeling of yawning and cravings. Aura is with weakness, visual issues, tingling sensation, aphasia. Migraine headache comes with irritability, nausea, vertigo, sensitivity to light, sound, and smell. Postdrome is a phase when there is a feeling of fatigue and hangover. 35-year-old female recently changed her job and is taking several night shifts. She presented with a headache for the last 2 days. She had similar episodes in the past. Tension headache is bilateral frontal headache which is mild to moderate in intensity. It is pressing or tightening type of a headache which lasts from 30 minutes to 7 days. Frequency is at least 10 lifetime episodes. This headache is treated with over-the-counter medications such as NSAIDs. A 30-year-old male presents with a headache for the last 24 hours with red, watery eyes. Cluster headache is retroorbital supraorbital pain, severe in intensity, wakes person from sleep. It is constant stabbing type of a pain. It can last from 10 minutes to 2 hours. It is quite frequent as 8 to 10 episodes per day. It is associated with watery eyes, eyelid swelling, nasal congestion, rhinorrhea, unilateral horners. It is treated with oxygen and triptans. Prophylaxis is verapamil, lithium, prednisolone. Maya is a 25-year-old previously healthy woman now complaining of new right-sided neck pain and headache after her car was rear-ended a few days ago. She has had a headache before in her life, but this headache is different. She also feels that her right eye is drooping. Carotid dissection can occur in rapid deceleration, causing a tear in the carotid blood vessel lining. Unilateral headache with Horner syndrome following recent trauma renders carotid dissection. Whiplash would not be associated with Horner syndrome. A 33-year-old woman who is 26 weeks pregnant and has a severe headache. Her blood pressure is 150 over 100. In pregnancy, more than 20 weeks of gestation, if blood pressure is more than 140 over 90 and proteinuria is present, then it leads to the diagnosis of preeclampsia. And if seizures are present, then it is eclampsia. Preeclampsia is medical emergency. If patient is stable, admit and follow. Decide to deliver as approaching 34 to 36 weeks. In severe preeclampsia, there is a need to stabilize and deliver. Blood pressure is controlled with antihypertensive therapy such as labetalol. For seizure prevention, magnesium sulfate needs to be given. Risk of seizure highest in first 24 hours postpartum. Continue magnesium sulfate for 12 to 24 hours after delivery. A 65-year-old female comes with complaints of jaw claudication, vision changes, and weight loss, along with a headache. Temporal arteritis is a pain over temporal artery with abrupt loss of vision. Jaw claudication, scalp tenderness, constitutional symptoms. It is associated with polymyalgia rheumatica. The diagnostic test for temporal arteritis is temporal artery biopsy. High-dose corticosteroid is given to relieve pain and to prevent further ischemic episodes. A 27-year-old male presents with complaints of new onset of headache with fever and notices skin rashes on his chest. Symptoms of meningitis include headache, altered mental status, photophobia, phonophobia, neck stiffness, fever, and skin rash. Investigations for meningitis. Blood workup includes CBC with differential, electrolytes to rule out SIADH, blood culture and sensitivity. Lumbar puncture for CSF analysis to check for opening pressure, cell count with differential, glucose, protein, gram stain, culture and sensitivity. CT, MRI, EEG if focal neurological signs are present. Bacterial meningitis is a medical emergency. Do not delay antibiotics for CT or LP. Emphatic antibiotic therapy includes ceftriaxone, vancomycin. Add ampicillin if risk factors for Listeria monocytogenes, age more than 50, alcoholism, immunocompromised. Steroids in acute bacterial meningitis can be advised as dexamethasone IV within 20 minutes prior to or with first dose of antibiotic.